Linda, one of the common questions I get asked is, do men do these procedures as well? And so the answer is obviously yes. And so what we're going to do today is kind of freshen up a guy who is in mid-30s and obviously very successful and wants to just kind of look more relaxed and rejuvenated and good like facial symmetry and contour. So one of the things we discussed in doing is kind of relaxing some of these lines. They're pretty strong because he works in front of the computer a lot, so there's like a very deep frown line.
Exactly.
And if you can push your forehead up, there's some lines here that are forming, right? So they're basically creating this tired look here on the central face. And then in discussing sort of what we do with facial contouring, one of the things that we talked about with this patient is, if you look, his face is very, very square here.
It is, yes.
And so how do we create more of an arch so that it looks more chiseled on top, and we can create this nice angle so that it looks more chiseled and less square, which looks very youthful and looks actually very athletic. Also, he has a few growths on the side of the face and some milia, which are just obstruction of pores, and we're going to extract those, and then he'll be all spruced up and ready to go.
Is there anything that he could have been doing or is doing that would cause the milia?
Yeah, that's a really good question. A lot of men are very opposed to using like a routine.
Oh, and they should.
So some, yeah.
They should.
Since you're sermon
Listen,
for
Rush.
today. So one of the things that really helps is like actually vitamin A creams or retinols or retinoids. But even if you do use it, sometimes these just happen because there's obstruction of pores, and it can happen because you slept on the pillow, or you've been working really hard, which is probably this case, and just there's like oil and dirt and stuff building up on the skin. So it's very easy to extract, and they leave no scarring, and then he should be good by next week. He'll be nice and chiseled. The Botox obviously takes a little bit longer to kick in, but the fillers are instant, so we'll be able to see that.
Wonderful.
So one of the things we're going to do now is we're going to ask the patient to make several facial expressions, and I'm going to put the Botox in your facial expressions so they look natural to you, okay? So we'll start with the first expression. Give me that mean frown. That's right. Perfect, okay? Now go ahead and relax. So those are the two bellies of the muscle that we're going to be doing. Does this hurt?
No.
Okay. This is the first time, so it's a big deal.
Yeah.
You're a brave man.
It's because you're holding my hand.
Another frown, please. Perfect. Go ahead and relax. Now with men, because we don't want them to look feminine, we have to make sure that we don't plaster the face so much that there's no expression.
Right.
We also have to be very careful that we don't raise the brow and cause an arch, because that looks very feminine. So what we want to do is knock out the frown, because no one's going to miss his frown. I assure you. Your wife will be delighted that it's not there. And then for the forehead, what we want to do is create sort of like a light, feathery effect. So it looks like he can move, but there's not that many lines. So if I can have you push your forehead up again, perfect. Go ahead and relax. So this is how high the wrinkle lines come. So we just kind of work them into his expressions length. Now some of them have already left the mark, so I know exactly where to go. The other ones, we'll have them make more expressions. Have you move your forehead up again? Perfect. Go ahead and relax. And you don't want to go too low because you don't want to drop.
Oh gosh.
And that's the thing that people are very, very afraid of. Now, he has great distance, so we have a little bit of room to play with. But in general, that's the last thing you want to do. And in a woman, dropping the eyebrow ruins the arch.
Of course.
Right?
Of course.
Okay, push your forehead up again, please. Perfect. So this is where we really want to knock it out. In men, this V part is really important to really knock out, because if you don't, it looks very, very feminine.
Interesting.
So if you're ready, we're going to do the other side now. Okay, and if you turn your face towards me, please. Perfect. Push your forehead up. Great. Relax. Relax, please. I think that will look really, really great. All right, the next thing I want to do is now work on those cheekbones that we talked about, okay? Now, you are completely in control because you can look at it, I'll mold it in. If you want more, we can put more. And if you want less, I can actually dissolve the product, okay? So it'll be very customized to your taste, okay?
That's fascinating. We'll have a good eye.
I trust you, Linda.
We trust her.
So
Thank you,
too
Dr.
late.
Kormeili.
So we don't want to put too much in a man's cheek right here, right? Because then it looks cheeky and
Exactly.
feminine, looks like he's wearing blush. This is the key. This is the zygomatic arch. This is a bone that's very prominent in Caucasian people and less prominent in ethnic people. So this is where we want to accentuate. Go right on top of the bone. Am I hurting you?
Oh.
And it's very, very subtle. When someone sees him, they're obviously not going to know what happened.
Exactly.
But he just looks a little more chiseled, just ever so slightly. Now, it's important to tell patients not to drink alcohol or take any kind of painkillers and actually stop vitamins. So what we're using here is Lift, which is Restylane Lift. And it used to be called Perling, but they got...
That's how I knew it, yes.
So now if you look, it's ever so slightly that he has a little bit more here
Oh, yeah.
than there. Does that see that?
Mm-hmm.
See that subtle change from here to there? Yeah. So I'm going to duplicate it on the other side. Okay. Now you can decide if you want more, because then we're going to put something a little softer, because we don't want you to be too cheeky at once, because then it's pretty obvious you had something done. What's amazing is as soon as you start doing fillers, you realize everyone's a little asymmetric, and they actually start seeing their own asymmetry. So it's not uncommon that patients say, oh my gosh, like this side of me looks different than the other.
Right.
So one of the important things is just to have them look. I want to checking for symmetry. We're a little bit off here. Looks very nice.
It does. It looks very natural, too.
Yeah. See, no one's going to know he has this done, but look how much lifting we got. And now one of the things that he's concerned about is this dark circle under the eyes, because he has allergies.
Yes.
And he's constantly sleep deprived, so that really accentuates this. And if you don't want to treat someone under the eyes, especially particularly someone who wears glasses, one of the tricks is to really accentuate the cheekbone so that the focal point of the person's face when someone looks at them is not here, but it diverts it here. It's just kind of a little trick. So if it's okay with you, I actually wouldn't mind putting a little bit more in. So this is the Juvederm Ultra Press. So it's a little bit lighter and more of a malleable filler. So now that I created kind of like a bone dense, I'm going to just feather it out and make it a little bit lighter with this.
Okay.
So that he has like very natural contours. Like again, we don't want him to look like a girl with
Absolutely
high arched
not.
cheekbones and big cheeks in the middle of the face. And as cute as that looks on a woman, it does not look nice on a man.
Absolutely not.
So we want to create more of a rugged look, and the rugged look is more on the side of the face as opposed to the central area of the
Brilliant.
face. It's important to know that this is going to swell. The swelling will go down. You will not be stuck with that swelling. Big difference. You see how much less we can see those bags under the eyes now?
Yeah, it's
just
true.
by doing this. Do you see that contour? Like we don't have like a big cheek like a woman, but he has that little bit of a chiseled look that looks
Very
great.
much so.
These numbing creams are so great these days.
You feel nothing?
Very little.
Now he particularly is missing a little bit of fat here, and this happens in athletic men.
It becomes, very hollow.
So you just want to replace that so he has more of a natural contour. No one knows this is not fat in his face. It looks just like that. So these are all very subtle, and when you look at a patient from different angles, you can actually see where they cast the shadow, and you just like fill that shadow. So it looks
That's the secret.
That's the secret. You're being terrific, by the way.
He is. Now, he is very athletic. As we said, he plays basketball on weekends with his friends. When will he be able to do that?
He'd be able to do it as soon as his swelling is minimized. The basketball itself is not a problem. It's the dirty hands.
Right.
Because
and what about the jumping? And
it should be okay. It's usually heat that really triggers people to swell more. Makes them swell. It doesn't ruin the filler. Now he has a little bit of asymmetry here compared to here, so I'm just going to fix that. Now in certain areas of the face, it's so important to retract the needle and make sure that we're not in an artery, just for patient safety.
I've seen that done.
Yeah, it's very scary. Perfect. Okay, now you're beginning to swell, so we're going to finish up your procedures and I'm going to let you ice then. Okay, perfect. So we're going to get rid of these little growths you had on the face that you had told me you didn't like before, which are right over here. And these are called DPNs, dermatosis papulosis nigra. They're kind of like in the same family as skin tags. Are you comfortable? Mm-hmm. Yeah, as soon as you numb up someone, you can actually comfortably do this. So to them, it feels like these like little growths on the face that make you look bumpy. Once you get rid of them, they create such an evenness to the skin because the light does pick those up.
So will he change any routine cleansing-wise?
So for him, I would just say stay out of the sun, which he can do. Just no scrubbing and no like harsh towel rubbing, okay? So this is the official pimple popping equipment for dermatologists. So you could see that these are filled with actually necrotic dead skin tissue and dead keratin and all sorts of junk. I do really find it very gratifying to get rid of them because it's such an instant gratification and they're right off the patient and they leave so happy because they've tried probably with their nails
exactly, that's what I meant.
Fork and knife and all sorts of stuff to get rid of them, and they're actually deep enough where you can't scrape them off yourself, and if you try to, you can scar because look how sharp this is.
Sure.
Now, closer to the eye we get, the more chances of bruising.
Right. Now, let me ask you something. Would it help in any way for the patient to take arnica or anything like that prior to?
That's a great point. So for people who are more likely to bruise, especially in areas like if we were treating his under eyes or lips and things like that, it's very important that not only do you not take things that thin out the blood like vitamin E and ginkgo and fish oil and alcohol and ibuprofen and all that stuff, but that you also take a little bit of arnica and you can just put it under the tongue.
Sublingually.
Exactly.
Right.
A couple of days before the treatment and then continue after the treatment. We put a little bit of cream arnica and we give patients arnica to take home.
Okay.
And we give them ice to go home, so for the ride home, that they're doing everything to minimize bruising.
The inflammation, right?
Because he's going to swell quite a bit before he comes down, especially since it's his first time having hyaluronic acid. And hyaluronic acid fillers are basically like sugar molecules that bind a lot of water, like 100 times their weight. So he's going to swell up some before he goes back to his natural contour. So I always have patients look and follow through, make sure that this is a good treatment before we go.
Right.
So how are you doing?
Doing okay.
Okay. So we're all done.
Thank you.
You're feeling okay?
Doing okay. Doing
All
okay.
right.
It was pretty painless.
Okay, excellent.
Thank you,
Linda.
Thank you, Raj.
So we're going to clean you up now. We're going to get you some arnica on top, some ice, and then you're ready to go. Give it about 2 weeks. If there's any asymmetry, we can obviously correct it.
Great.
Okay?
Thank you so much.
You're welcome.
You're welcome.